departure. Hello again. All right, are you ready? I'm Quinton Lucas, Mayor of Kansas City. I want to thank you all for taking the opportunity to listen to us today. A few things I wanted to start off with. First of all, it's been a particularly trying time of late for first responders in our community. I want to send my condolences to the family of Independence firefighter David Jamison Jr., condolences to Overland Park Police Officer Mike Mosher's family, and certainly we continue to think about Kansas City Fire Department EMT Billy Birmingham. As we've seen from these line of duty tragedies, our tasks remain quite challenging each day, and there are heroes in our community that go out and do that work regularly for us, so I thank them for that. The next thing I wanted to note was just how serious times still are. There is a significant conversation right now about reopening. And while reopening certainly is part of our narrative and our discourse, we have to understand why we are actually here right now. It's because COVID remains a significant threat. It remains a challenge for too many in our community. Kansas City, Missouri at this point has 730 cases. Our metropolitan area has roughly 3,000. What that means for all of us is that we have to stay vigilant. We have to make sure we're following all of the advice that we've had. And as we have conversations about reopening, we need to actually understand that that doesn't just mean reopening and forgetting all the work that we've done up to this point. We have to make sure that we maintain social distancing. We have to make sure that our business community, and I've been heartened by it, are following important steps to keep their patrons, their employees safe, and all of us safe. And then we all have to actually make sure we're working together to try to make sure we're stopping that next outbreak, that we're containing this virus as it continues to spread throughout the community. I know it's not lost on anyone that last week the National Football League announced its schedule, including the Chiefs kicking off on September the 10th. What I would say to anyone, and I'm a big Chiefs fan myself, the way we actually get to that point of an NFL season, a full Arrowhead Stadium, right, full events, full activities, is if we get it right now. If we're stopping the spread of COVID-19 now, if we're stopping the spread. So that's why we have to make sure that we are still strict now. That's why we have to make sure that we're working our best to get it right. Now, I'll just briefly note, when we had announced a change in our beginning of our soft opening on May the 6th, part of the reason for that was because we had had several weeks of declines in cases, or at least a flatlining in our number of cases. And we were proud of that progress throughout the month of April, largely. I think it's not lost on anyone that last week we saw a spike in some of our cases in Kansas City. That includes cases that were tied to the meat packing plant in St. Joseph. It includes cases tied to a nursing home or senior care facility in the Northland of Kansas City. And we also continue to be concerned by the outbreak at the Lansing Correctional Facility in Northeast Kansas, because as many of you know, this is all one area. People travel around them. I used to actually volunteer teach at Lansing, and so we recognize that any outbreak in our region certainly can threaten all of us, so we need to work together to make sure we're maintaining this. So you may ask the question then, why do we feel confident now in having our order elapse on May the 15th, and how do we feel like we can have sufficient safeguards? A few things that help us on that. First of all, thus far, as we look to the spike from last week, many of the cases are tracked or related to a few of those larger outbreaks we've seen. The gravest threat that we see during this phase is if there is broad community spread and we don't know where those cases are coming from. Right now, we don't believe that to be the case in Kansas City. And so that's why we felt we could continue to proceed on our plan of a responsible, a somewhat soft reopening in Kansas City. Another part is that we continue to add more resources each day in Kansas City towards our operations to try to make our community safer. That includes paying for and funding more testing. I want to commend the City Council for once again allowing us to spend more money with more safety net hospitals in Kansas City and in the Kansas City area to make sure we're addressing testing issues. And we continue to do more work on tracing. As something as our Director of Public Health has mentioned a number of times, we do need more dollars to help address that. I continue to work with my friends across the street at the Jackson County Courthouse, my friends in Clay County, Platte, and Cass County. We need federal dollars that are on the streets in Kansas City to help address our testing and tracing issues. That's going to be vital for how we address this. And then I'll make a final point, which is that Kansas City doesn't live on an island. I recognize that my friends in Clay and Platte and Cass counties opened up largely May 4th with fewer restrictions than we probably will have even after this. Our friends on the Kansas side are opening up at different stages, and Jackson County is doing the same as well. We are going to make sure that as we reopen, though, in Kansas City, we're always looking at what is the best possible public health guidance we can provide. And we think the outlines that we're giving today connect to that. First, I'll note that all non-essential businesses in Kansas City, by and large, will be able to open as of May 15th. But that is subject to our 10-10-10 guidance. Again, that's a 10% capacity rule, 10 persons, and I should say, a recommendation that folks sign in if they're somewhere seated or if they touch equipment for a period longer than 10 minutes. I'm always asked questions about what is enforcement and that sort of thing. Look, we already have a busy police department. We have a very busy health department. So I recognize that much of what we do will relate to voluntary self-compliance. I also will note, as a lawyer myself and a lawyer who's worked in negligence cases before, there is a doctrine known as a standard of care. If government issues a regulation and then businesses just thwart them or don't follow them, and then there's a subsequent outbreak where lots of people get sick, I would think that business puts itself into some level of exposure for violating that standard of care in any given situation. That's part of why we give rules and mandates. That's to give a good guidance for conduct, even in situations where people won't follow it. But I'll also make this point. This is a floor, right? The law, rules, orders always set a floor for activity. What this does not mean is that because the stay-at-home order, as we knew it, will have expired, that everybody should just go out and have the biggest party and have the greatest time ever and just hang out with 200 of their best friends. We encourage you to continue to maintain those social distancing guidelines that you heard before. Indeed, our order still has a limit on gatherings of 10 people inside, or 10% of a capacity of a building, 50 persons outside subject to social distancing. We also note under those gathering guidelines, that's a gathering of any type. Whether you're going to a lecture, whether you're going to a religious ceremony, or anything under the sun, there are 10 inside or 10% inside and 50 persons outside. Gathering guideline remains the case. And then something that I know folks are also interested in is in connection with our restaurant guidelines. The way that we've done that was through good collaboration with our local business community, and I'll note I have several people here from the Greater Kansas City Restaurant Association, David Lopez and Bill Teal. They are here because I think in a way a reflection of the work that we had together. Every step of the way when we said we want to make sure that your patrons, that your employees are safe, they said we wish to make sure they are safe too. And so that's how we've come up with guidelines of the following. The first of which is that patrons who are exhibiting symptoms should not be allowed to dine, nor should those who are exhibiting symptoms be allowed to come to work. Our capacity limit will be removed, and we'll go with a distancing requirement. The distancing requirement is 10 feet between tables and 6 feet between the backs of chairs. If you think about it, it makes some level of sense, right? You have a certain amount of space between the tables, and then people sit somewhere closer. So 6 feet between the chairs. Bar seating is not permitted at this time. Buffet service is not permitted. All employees who are in the front of the house of the operation, i.e. who face and deal with customers, are required to wear face coverings, much like our rules as it relates to salons and other personal services. And frequent cleaning of surfaces that are steadily touched is required up to every 90 minutes. In addition to that, our restaurant industry and our bar industry will need to work with the Director of Public Health to make sure we're following those guidelines along the way. These rules apply to restaurants and taverns. However, we will note that taverns, bars, right, will need to have persons seated. And so instead of having a crowd that can just move around kind of randomly, we'll have those same rules about spacing requirements as it applies to taverns. We will also, through City Council, continue to do the work that we've already talked about in Westport and several other neighborhoods to try to open up more sidewalk and street opportunities so that you can have adequate social distancing. Our rules on distancing also pertain to outdoor seating, patio-style seating as well. So these rules will be consistent with the rules that we've seen in other areas, our salons and so many others. We're continuing to require social distancing. We continue to require masks. We continue to encourage everyone in the event of an outbreak to keep your appointments, to keep your reservations for 30 days, because that's how we can actually stop an outbreak. And the thing that I note once again is this. Our story of how we live with COVID-19, the story of the next several months, is how we can contain an outbreak. And the way that we contain an outbreak is through tracing, is through making sure that we're actually letting folks know if they're exposed. Through tracing, you're actually doing a favor for someone, because if there's an outbreak at your restaurant or your salon, you have the opportunity to call people and say you should get tested, you should quarantine, and so those folks know that they're not spreading it to a loved one, to a family member, or anyone else. And so we see containment is key. Good hygiene remains key, but also staying responsible remains key. That's why, although we have things opening, we encourage folks of all ages to be judicious on your trips out. We encourage folks of all ages to make sure that if you're going to work, right, first you don't, if you can still telework, but if you are going to work, you maintain that social distancing that's necessary. We also have a few things in our order that I will note for you in terms of essential or non-essential activities that will now become open. We're anticipating that even though schools have closed for the school year, that there will be questions as it relates to summer school and youth activities in the summertime. With this order, we're eliminating the prohibition on youth activities, eliminating the prohibition on daycare-related activities for non-essential workers, and so those activities can commence, subject to a number of rules. 10-10-10 still applies, so 10% capacity, social distancing. We encourage those who have daycare facilities to keep children in groups of 10 throughout the entire day, and so that will be just one of the areas that will continue. We also continue to work with the Department of Parks and Recreation in connection with reopening any number of facilities. This order allows for dog parks to be open. This order allows for playgrounds to be open. The Department of Parks and Recreation is going to promulgate specific guidelines as to what reopening looks like, particularly as it pertains to activities with any number of people. We encourage you to note that in connection with your activities, right, you're still under these numbers rules, so gatherings greater than 50 persons outside with social distancing are not permitted. So with that, that is a look of what we're doing. I have to note, I think emphatically once again, today is not about just reopening and being past a moment. Instead, it actually just speaks to another phase for us. It speaks to the fact that while we are living with COVID-19, we're going to do the work to make sure that we have strict rules. I know there are many that have said 10-10-10 seems like in some way it's a significant and strict challenge. My answer to that is yes, it is, and that's intentional. We want to avoid crowds. We want to avoid crowded activities. We want to make sure we're being smart with reopening. As we all know, it's hard to close Pandora's box. And so what we want to make sure is that we give ourselves enough time looking at these sort of guidelines to then say, all right, have we continued to see a flattening of cases? Are we seeing a point where we can move to a new percentage capacity threshold, such as 25%, and then ultimately up to 50%? And that's the sort of work we're going to do, and that's how I believe we can responsibly reopen in Kansas City. Every case presents a challenge. Every case presents an opportunity for spread. It's my job, it's the health directors, to try to do as much limiting of that spread as we possibly can, while recognizing that society will become open, while recognizing that we live in a metropolitan area that has some areas that are open, more open than others, but while recognizing we need to do all that we can to contain the spread of COVID-19. With that, I'm happy to take any questions. I'll go, as always, left to right. Ms. Kite? So the question relates to and sorry, John's my shouter, why a distancing requirement as opposed to a 10-10-10 capacity. In our conversations with the Restaurant Association, we noted, first of all, in a lot of restaurants, 10 feet itself is actually a fairly stringent guideline in terms of how the spacing will go. And so we saw that actually in that balance, both as a matter of public health, but also just when looking at their business operations, there are some restaurants, I shouldn't name them because I'm not here to advertise for folks, but a 10% capacity rule would actually be fairly significant and would allow a high number of people. Whereas what we were most concerned about, and sorry, it's a day in Kansas City, what we were most concerned about was the idea that we wanted people to have more space, we wanted to avoid more crowding, And what I understood from my friends in the Restaurant Association and certainly the Director of Public Health was that if we keep that 10% from edge of table to edge of table, you're allowing for that greater spacing between people. You're allowing for waiters and waitresses to pass without bumping into people. And frankly, you could see an easier approach to enforcement in that given situation. And so it was really that combination that led us to go with that metric for them. Yes?
Are there other requirements such as paper menus?
Yes. So there's a whole list of requirements, and we'll have frequently asked questions up on the Kansas City, Missouri website soon. So if you go to kcmo.gov, or if you search for coronavirus, you can find our guides there. But yes, just to note all of them, we require, in addition to face coverings, single-service menus that can be thrown away after one use, or cleaning and sanitizing menus between every customer. We continue to talk about that logging requirement, or at least recommendation, which we encourage, and I know many of the restaurants I've talked to say that they have no problem keeping their reservations and that sort of thing, and then certainly a ton of sanitization type requirements and issues. Michael?
Why are restaurants catching a break here when other businesses are not? In the sense that they're not going to be kept in. Why are restaurants catching
Sure.
a break when other businesses?
We've always looked at why are some restaurants, and repeating the questions for anybody watching, why are some restaurants under 10 or not under 10-10-10 while other businesses are? 10-10-10 is going to be the default rule for every business in Kansas City unless there is actually some stricter guidance. Because restaurants themselves are actually fairly closely and highly regulated by the Department of Health already, because we go to inspect them with some frequency, it's our view that we actually already have a relationship where the Department of Public Health will more frequently actually be going in for inspections of restaurants to make sure they're complying with the rules. Compare that, for example, to a law office where we almost would never go. And so that's why we have clear, consistent guidance for non-essential businesses more broadly. Restaurants, we think that we're actually able to make sure that they're following those rules more significantly, and that's why we're allowing them to have slightly different guidance. I also am of the view that I'm not sure that a 10-foot between tables requirement, depending on the size of your restaurant, is actually looser than 10-10-10 is. If you are in a certain space, right, 10% and the 10-10-10 rule is actually based off of building capacity. And one thing that I think was actually kind of lost in that is building capacity is a lot larger than you might think. For example, the lobby of City Hall, where almost no one ever sits, probably would allow in excess of maybe 150 persons to actually congregate there. So therefore, you could actually have more activity. A 10-foot spacing requirement, however, is actually fairly significant, making sure that we can still keep that space between tables. It's for those reasons and a number of others relating to restaurants, the fact that people are eating, right there, there is a potential for transmission there, that we thought our clear distance-based guidance, which can be measured by the Department of Public Health, provides us better protection than actually just a capacity guide. And kind of some of the spirit of our percentage guidance under 10-10-10 was that we're trying to avoid the existence of crowds. And so in trying to avoid crowds and congregating and that sort of thing, we've actually said, well, having fewer people in a venue at least allows us to do that. Now, granted, people can go to different spaces and that sort of thing, but that was the work we're trying to do. In restaurants, we have the same concern about crowds, but it's really kind of about not having something jump from one table space to another, and that's where we think 10 feet actually addresses that concern.
Mayor, what will you do, or what are the regulations call for in terms of people waiting for a table?
Sure. They're under the same social distancing requirements, so 6-foot spacing in waiting. I imagine in some venues that would mean that folks cannot wait inside, and so that would be outdoor waiting. It would mean coming just in for the reservation itself. I have faith that our restaurant businesses will be able to do that, but no, you will not see groups of people lined up in that same kind of small cubby area. In the same way that we've moved our press conferences outside, I think you will see, particularly in our spring and summer months, more utility of the outdoors and spacing, more people just coming in to eat, waiting in cars, that sort of thing, which we've already seen actually in the provision of personal services in Kansas City thus far.
One final question here. The Restaurant Association does not have a lot of clubs that have members. If people can't stand or sit at a bar, there are a lot of facilities that won't be able to. We'll be back in the same plane with the Restaurant Association is making a 10% occupancy limit that is not workable distance.
So in connection with bars and taverns, I think we were as flexible in this phase of openings as we could be. Dr. Archer and I had a good conversation actually with some of the Restaurant Association folks who I think were looking out for their brethren who might be in the non-food service side of things. It is our view that this is the safest that we could do for reopening. To the extent that a facility of any sort can't comply with our rules, whether they be 10-10-10 or the restaurant-specific rules, then we understand that they likely will not open. This is as a matter of public health and public safety. This is why these rules exist. This is why we have strict rules, because it's our view that right now the best way that we can maintain safety for someone is having strict guidelines, either as it relates to capacity or strict guidelines as it relates to the spacing that's going to exist between places. My job is not to be a bar owner. God bless them. It's not to be a restaurant owner. My job is to be mayor and to look out for everybody in Kansas City. And so that's why we're actually sticking with these rules that our view is in the best interest of public health.
One final question here, very briefly. So would you anticipate that not many bars open up under this?
I have no idea what bars will look to do. I think that we've given them a template for reopening. I believe it's one that could work in the same way that restaurants are going to be tasked with reopening in a way that is very different than their business plan. As far as I know, I've never run a restaurant, but they don't necessarily love cutting out half the tables at their spaces. They don't love actually having any number of new guidelines, but I think they're willing to do it because they want to make sure their patrons and their employees are safe, and I commend them for doing that. I think that probably our bar and tavern owners would have the same view. Any questions for you? Okay. Good.
Should establishments consider these hard rules like a mandate, or are these suggestions?
Yeah, I'll take this directly and then I'll take it more theoretically because my staff always gets mad. Are these mandates or are these recommendations? Almost everything is a mandate. And so as we have it written, if there is a shall or a must, right, then that is a mandate. Subject to an ordinance violation penalty, subject to closure by the Department of Public Health or the Department of Regulated Industries. Recommendations do exist in some areas of our guidelines. Those will always be your shoulds. But I will say this because it's just honest. Our whole thesis right now of how we're handling things is that we're not going to throw a bunch of people in jail. We're probably not going to throw anybody in jail, right? We aren't in the business of wanting to issue a lot of significant fines. What we want to make clear to people is that these guidelines should be followed first because you care about your fellow human beings in this community and being healthy and safe. But then next, because they are actually, I think, in some ways fairly reasonable steps that allow us to open later. What I would think a restaurant, for example, that let's say doesn't want to do 10-foot distancing and wants to do 5-foot distancing. One, they don't want to be closed down if people learn about it. But even more to the point, they don't want to be the restaurant that had a huge COVID-19 outbreak. In the same way, they didn't want to be a restaurant that had some sort of spoiled food outbreak. And so I actually think self-responsibility will go a long way in connection with it. I don't believe that self-responsibility is everything. That might be where I disagree with maybe our state leadership and a few others. I think clear guidance, clear rules are helpful. But I also recognize that in a city of 505,000 people and a lot of different restaurants, Rex Archer doesn't have a staff of 3,000 people to go look at every restaurant every day. That's why I think it was important that we worked with local businesses and how we were promulgating these. But I think these guidelines, while the strictest in the region in many ways, are still ones that are workable for business. That's why we talked to the Greater Kansas City Restaurant Association about it. I think our 10-10-10 guidance, I actually disagree with some who may say they're not clear. I actually think it's very clear. If you get confused, just use 10 as your number. And if you walk into a space that seems like it has too many people, does it seem like that this is a large capacity? That's probably an issue that's a concern and a challenge. And frankly, I think capacity rules that we have in Kansas City, right, are actually what you've seen in a lot of our other counties, particularly on the Missouri side, where Governor Parsons' orders continue to have a capacity rule, at least as it relates to larger retail establishments and smaller ones. So I think that in many ways there has been much discussion about difference in viewpoints, among other things, of jurisdictions here. I think you do see some consistency. You see consistency in all of us trying to avoid large crowds. I think you're seeing consistency in all of us trying to make sure that social distancing is as respected as it could be. Some of us make it mandatory, others make it a recommendation. And I think you're seeing consistency in every jurisdiction around here trying to do more work with testing and tracing and containment, knowing that that's the way that we actually fight this long term. Yes. Yeah, he got 4 of them, so you're fine.
For a tavern that's traditionally operates only bar seating, at this point they should be looking at table seating or a different way to accommodate people in their place of business.
I think the answer would be yes, and it can be cured as simply as having chairs that are in spaced areas. And I will note this: there was one mistake in what I had seen in a media report. We have 10-foot requirement between tables. It's 6 feet between parties of people, not individuals. So you don't have to sit at a table 6 feet away from your spouse or someone else you're eating lunch or dinner with. Instead, you can go to a restaurant and be in a closer set with the party that you are with. You, however, need to be 6 feet at least physically from another party. And so for bars and taverns, that would be a similar type of guideline. Yes, ma'am.
When you announced the 10 rules a couple of weeks ago, one of the reasons that you felt like it was safe was that continued decline in cases.
Yeah.
Did last week's spike disrupt that line, if you will? And if so, is it safe to continue reopening businesses?
Last week's spike certainly arrested the progress that we were making. And it certainly made us reevaluate, I think, the steps we were taking on reopening. I think it made us actually in some ways stick with the 10-10-10 rule guidance. I know there were some who wanted us to move to a 25% threshold, but I think it's premature for us to actually jump up in our capacity guidance. And I think that we will continue to measure spikes for how we change between the different levels we're in. In Kansas City, we have this percentage capacity rule. We've used our 10% guide as how we can look to a number of operations of businesses. I think we will continue to stick with that until we are confident enough that we're at a point where we can say the community is safer and we can have more folks that are coming in to open establishments that have a crowding capacity.
And at what date or by what criteria will you consider that?
We continue to look to new infections on a week-to-week average. I think we continue to plan to enhance our testing and tracing capability, and hospitalizations are always relevant. We're at a point now where I think we are okay with where we are in hospitalizations, but certainly if we see a change in that, then we would address it. In terms of when we would look to come back to you with a new order, always depending on certain variables, but this order runs through May the 31st. So we would expect to have other guidelines perhaps for the month of June thereafter. I know I do get questions sometimes as it relates to events. There are people that call me and say, Mayor Q, I'm going to have my wedding in June. Can it happen? First answer is we don't know. I think it's easier to predict based upon just the rules they exist now, which is if you can have 50 people outside and be socially distanced, then your event in June is fine. Until we get closer to that point, until we look at the data, until we get further advice from Dr. Archer, we're not in a position to actually have clear guidance on that, although we all certainly hope. It's why I made the Chiefs example before. I'd love to be there with 78,000 people at Arrowhead Stadium in September. How we get there requires us to make sure that we're actually containing, make sure that we're seeing a decline in cases, and making sure that we are out of the woods as best we can be. If we can't do that, then we will not be there in September, and we'll have more concerns long term. Yes, ma'am.
The businesses who've been allowed to be open just under the rule of social distancing, like grocery stores, and
Yes.
liquor stores, and all that kind of stuff, will they be under the 10-10-10 rule as well? Because, you know, it's kind of willy-nilly just telling them, well, just stay away from each other, some do, some don't. So are they now under that 10-10-10 rule as well?
So larger businesses, so for example, your grocery stores, your home goods stores, essential businesses are not under the 10-10-10 rule. However, Larger retail establishments, by order of the governor of Missouri, remain under a 10% capacity rule under that order, and that does apply in Kansas City, and a 25% capacity rule for somewhat smaller retail establishments. So actually, whether you're watching in Kansas City or Harrisonville or anywhere, right, you are still under that 10% capacity rule at those larger retail stores. I do know that many weekends people say, well, there were tons of people at name your place. To the extent that those rules are being violated, you can also call 311, and they are supposed to be keeping track of those types of limits as well. So there really is actually the front 10 of the 10-10-10 rule for every retail establishment, a large retail establishment in Kansas City.
Mayor, do you envision any circumstance whatsoever where the police would be called to enforce emergency orders?
Unlikely. I think the way that we've done it before, and we had an example like this with a business in the Northland before, the question relates to whether the police will be called to enforce. The health department worked with that business. The health department continued to work with that business. Every now and then, if the health department needs assistance in the exercise of its own duties, then they'll call for support from the Kansas City, Missouri Police Department. But no, we've worked very hard to build up good relationships between the police department and our community. We will not have police doing things like policing the wearing of masks. We won't have police doing the things like I think you saw recently in the city of New York, where there were park rules that were being enforced and police were exercising some authority there. I think what we're trying to do is make sure that we're using health, regulated industries, and others, and where the police department can provide assistance. They've shown a very kind willingness to do so. We've appreciated that, and we'll continue to call them on that. But no, we are not trying to have a great large enforcement force that's running around the community. What this is about, very simply, and this is why we have press conferences and this is why we talk to people, we're trying to appeal to the good senses of every business owner. We're trying to appeal to the good senses of every person in Kansas City. All right, if we take these steps now, right, we can contain the spread of COVID-19, we can make our community safer, we can make people healthier. I understand that reopening would start happening. If I had my real druthers and lived in a world that was just about Quinton Lucas rather than everybody else, we probably wouldn't be here today even talking about reopening. But I also understand that Kansas City's not on an island. I also understand that there are businesses and others, and so we only create rules that are as necessary as possible to make sure that people stay safe, but where we can strike a good balance with public safety and our community being able to actually do what it needs to do.
What do you mean by we probably wouldn't be here? That very strict guidelines would be in?
I as a person live in some ways somewhat differently than perhaps some others would. So I'm personally probably not going to any number of establishments for a while. I actually haven't been to a large retail store, although I could have been, for probably the entirety of this order. I would encourage a lot of Kansas Cityans who may be watching right now and are concerned to consider the same step. I would encourage them not to go out for lots of activities, not to go out where it's not necessary. I think that is now at the point of an individual choice in a number of different ways. We continue to have rules to make sure large crowds won't congregate, but I think with reopening, whether it be in Kansas City or anywhere else in this metro, everyone should limit their trips. Everyone should actually look to maintain social distancing, wearing masks in public to the extent possible. I've been asked the question sometimes, will Kansas City, Missouri mandate the wearing of masks? The answer is it's unlikely that we will. Part of the reason is because, it's likely something that we can't necessarily enforce every person walking down the street doing so. It doesn't mean that we don't very clearly recommend it. And so my view is that we'll continue to make sure that we're recommending, I think, important steps for all of us. But no, I think as an individual, we should all try to do what can make us most healthy and safe. And I have no interest in exposing my family to any risk because I'm out and about too often. Yes, ma'am.
I just have a question in regards to the zoo.
Yes.
What type of rules do they follow in the community?
So the Kansas City Zoo and everyone in the Department of Parks and Recreation are working on their own steps towards reopening. By virtue of the order that I'll be signing today, they'll be in a position where they can reopen. However, they are trying to make sure that they're going through the work to be prepared. A few ideas that they've already let out, and they'll be giving more, include the following. One is eliminating those areas where you would often have a zookeeper who speaks to a crowd of people. eliminating those, eliminating areas where there's common touching. If you've been to the cafeteria area of the Kansas City Zoo, that's but one example. And I think you'll see other guidelines coming from the zoo and other parks and recreation facilities and the Kansas City Public Library to make sure that we're sanitizing more surfaces, that we're avoiding crowds where they may congregate, where we're doing all the necessary steps to make sure people stay safe. Okay?
Thank you, everybody.
All right. Thank you, everybody.